Hi, everyone who's just joining. We'll just wait a few more moments for everyone to enter, and then we'll get going. Okay. Well, let's make a start. I think a few people are starting to join, and there'll be a few more coming in. My name's Geordan Shannon, and I'm part of the Planet.Health organizing team. And today is the second in our series of unlikely conversations, where we're attempting to build a bridge between two quite disparate communities of practice. On the one hand, we have planetary health. On the other hand, we have the blockchain world. And a group of us sort of sitting in between them realized the potential of bringing these two worlds together, and thus came about Planet.Health. So we are running a series of 4 webinars at this very point in time, with the view to do more in the future, as well as an in-person event in France to start to build these bridges. So the focus of today's session is communities, care, and planetary health. Communities are central to planetary health and the blockchain. So in the planetary health world, we know that community voice and mobilization underpin effective action to tackle the health impacts of climate change, or more generally, suprasystem risks that we're facing in the world right now: supply chain shortages, food insecurities, economic stability, you name it. On the blockchain, on the other hand, community building and engagement are really central to functioning and robust initiatives. More so now when we're seeing really innovative structures set up on the blockchain to do social goods and to foster the building of social goods more generally. We're seeing targeted and frankly exciting innovations on the blockchain, including decentralized autonomous organizations and other types of platforms that are enabling community voice and participation, everywhere from universal basic income through to nature conservation. And once again, we just see that these two groups of people really need to bring this together. So what can the two worlds learn from each other? Today, we have an amazing panel to start to discuss that and really center this concept of community in our discussion. So we're really delighted to have Professor Audrey Prost, Shimony, and Parabita Basu join us. Potentially we'll be joined by Daniel Espina too. Let's just see how that goes. He might drop in a moment. So I will give every panelist a chance to introduce themselves, and the style of today is basically a Q&A. So it's designed to really probably raise more questions than answers, but we really want this to be a discussion where we are trying to really understand the commonalities between different groups of people in practice. So on the one hand, we have people like Parabita really representing some great innovations at the forefront of communities and health. We've got Audrey Prost, who's reflecting planetary health practice and research at a global level. And we have Shimony, who's done some amazing stuff on law and the blockchain and building of DAOs, decentralized autonomous organizations. So welcome everyone, and I will pass it now over to the panelists to introduce yourselves. So I'd love to hear a little bit about who you are and your journey. And firstly, I'm wondering if I could ask Parabita to introduce yourself. Over to you.
Hello, everyone. I'm Parabita, and I'm joining you from India, representing Ekjut, and our work span across different states in India. By education, I'm a doctorate in forestry and specialization in wildlife science. I started my career as a carnivore biologist, and I had a 10+ year experience of working with the tigers and Asiatic lions. I was mostly focusing on the landscape concept, but later I had many questions which I felt like I won't be able to answer if I just focus on wildlife. And I wanted to learn more about the social aspect, and then I joined Ekjut. And there I've been for last 6 years, and I've been using GIS and remote sensing technology to develop a spatiotemporal dashboard and adding the spatiotemporal component to the ongoing interventions in Jharkhand. I've been learning a lot, and throughout that, I've been contributing to the overall intervention towards improving maternal and child health and nutrition in the community. I would be talking more about it in the next. Thank you.
Incredible, Parabita. Thanks so much. Over to you, Audrey, to introduce yourself.
Thanks so very much, Jordan. So I'm Audrey Prost. I trained as a social anthropologist many moons ago, and social anthropology is a very expansive discipline, which in many ways prefigured a lot of the questions that we have today in planetary health, because it's concerned about relationships between humans and environment, and how material productions, relations of productions also affect these and affect human well-being. I've been working in public health for about 15 years, including with EGJUD, who Parabita is a part of. And within that, we've sought to develop approaches to build community capacities to address their own health problems, working in the areas of maternal and child health and nutrition, and also adolescent health. And increasingly, EGJUD's work, I think, has shown the interdependence between human health and the environment, and the living and non-living systems that underpin human health, especially when it comes to adolescent health. We might talk again about this, but youth in India, as in everywhere, are very concerned about the planetary crisis that we face, and they're coming up with innovative ways to tackle this as a community themselves. And we can talk a bit about that later. I'll stop here.
Thank you, Audrey. Now over to you, Ari.
Hey everyone, I'm Ori. I'm a builder and full-time participant in the DAO space. I've helped get Deorg DAO started over the past 4 years. We've been building a global community of blockchain developers that help advance and bring blockchain use cases into real life. And so I've dealt a lot firsthand with kind of the struggles of running and forming, growing, maturing an organization that's entirely built on code as its underlying operating system rather than legal agreements. But along the way, we've also had to figure out how you can interface such a system with the legacy legal system. And so I come very much from the perspective that blockchain dramatically democratizes, opens up access, reduces barriers to entry for people to do complex transactions like forming organizations with one another. And so I want to bring that beyond the world of perhaps speculators and people who are focused purely on the technology for technology's sake, and into spaces where people are struggling with the institutions in their areas, with money, with law, and with debt, and seeing how blockchain can offer kind of alternative ways to rebuild kind of these systems from scratch, but then also be building bridges so that people can exit systems that are messed up, that don't have their interests at heart and that weren't built by them, and enter systems that they can co-design. I also studied computer science and actually anthropology at the University of Virginia, which is where I learned about Bitcoin, and was instantly kind of like fascinated by how you can take this to use cases beyond peer-to-peer payments into the kind of stuff I'm working on now with DAOs.
That's amazing, Ari. And I think you raised two interesting points. So we're going to actually return to use cases in the second part of this panel, just to give everyone a real sense of what can be done in all of our respective worlds as well. The other thing, when you're talking about law, I think communities and governance in general and decision-making go hand in hand. And I think that's something that might come out in the discussions more generally soon as well, thinking of the great stuff that EGJUD and Audrey and Parabita have done. So turning now to this concept of community health, I've seen and heard a lot of people refer to community health on the blockchain and in the blockchain space, and community health from health practitioners has a slightly different ring to it. And so I want to turn now to ask everyone their reflections on what community health really means to you, and what that concept of community means across space, time, platform. So Parabita, with your work at ECJUT, could you talk about what community and community health means to you? You've probably seen a number of colliding health, social, environmental challenges exacerbated by COVID. So it'd be interesting to hear your thoughts on the concept of community and what you do to really to empower and give agency to the communities you work with.
Yeah. So in ECJUT, throughout our almost each and every approach, we try to focus on the marginalized and underserved communities. When I say marginalized and underserved communities, they are marginalized from many aspects, like from social aspects, from environmental, from remoteness. And also they they don't know many things. They are lacking of many awareness, information. They are facing societal taboos. And so these are some of the challenges that the communities are facing in Jharkhand or in other states, mostly in tribal dominated areas where we mostly focus on. In terms of health challenges, what we have seen, like maternal and child health issues are very prominent. There are issues with malnutrition, dietary diversity, women facing gender-based violence cases. All these cases are there that we have been facing, and we are trying to use the participatory learning and action approach to address those challenges as well. In terms of environmental challenges, as you were mentioning, like in Jharkhand especially, we have seen the frequent drought and then a flood, and forest fire. These are very seasonal, and nowadays with the change of climate and a seasonal pattern changing, these events are very much occurring. Means the frequency is more than it was before. If we see youth or adolescents as a part of community also, the challenges that they are facing is a lack of direction, then lack of guidance as well. And many times there are instances of school dropout, and then not finding the right livelihood option, lacking leadership opportunities. So those are many things that we try to focus on through our different interventions. So these are mostly the challenges, if we say health and environmental challenges, that we have been seeing with the community there. And we are also focusing on a particular community, which are called particularly vulnerable tribal groups, which are mostly the tribal communities whose populations are very low, and they are again restricted to different pockets, which are again remote. They are inside the forest, their lifestyle and their language, everything is different. So there is a challenges of communication as well. So these are a few of the characteristics, if we say, the communities we have been working.
Thank you, Parabita. And you mentioned this concept of participatory learning and action, and I think we'll talk more about the use case example of that in a moment. But for the benefit of the audience, I'm just wondering if you could talk a little bit about how you start to work with building communities through that participatory learning action approach.
Yeah. Yes. So participatory learning and action approach is a globally recognized approach, and it's not only we have been working in India, but in other countries like Nepal, Malawi, Bangladesh, where we have similar rural settings and high burden settings up there. And this has been established as a community mobilization approach. And once talking about it, Dr. Richard Hutton said that it's not a drug, not a vaccine, not a device. It's women working together, solving problems and saving lives. WHO in 2014 recommended this as an effective community mobilization approach, which helps in improving maternal and child health. And National Health Mission India in 2016 explored given an order to, or recommended the same to be explored in 10 different states of India, overcoming maternal and child health issues. It has proved to be an effective process where several interactive tools and adult learning techniques are being used by trained local facilitators to engage with the community. And technology integration is very much possible to effectively monitor the whole intervention. This is adaptive and innovative in a sense that we have tried this particular approach with many cadre being from the government or with adolescents, again, individuals from the particularly vulnerable tribal communities. And we have seen in all the cases, the results were very much encouraging. Financially, also, this approach is very much sustainable because there is a very limited investment required, and its cost effectiveness is also measured with the studies available globally. This particular approach is also equitable and inclusive in a nature because it's delivered in an open cohort manner where pregnant women, male participants from SC/ST, scheduled caste and scheduled tribe communities could participate. And this particular approach empowers communities in a sense that they get a chance to identify and prioritize their own problems and then devise strategies and also implement the same on the ground. It also helped the frontline workers who worked as facilitators in the entire process in terms of developing the personal and professional and communication skills to effectively deliver their services to the community. If we want to know about this process or the cycle, this has a four different phases. So in the first phase, the community identify and prioritize their own problems based on the themes, like if it's related to maternal and child health, if it's related to dietary diversity, nutrition. In the second phase, they devise different strategies to overcome those issues, the prioritized issues. In the third phase, they implement those strategies. And in the fourth phase, they evaluate themselves, like what went well and what didn't go well and all. In this entire cycle, a community takes ownership of the entire issues with them, and they deal with that. And there is always a trained facilitator who is also from the same community. So in that way, it helps to bridge the communication or language barrier. And the tools that being used, like picture cards or role plays, etc. Those are very much engaging in nature. So community owns the process in a way. I have many examples like how we have been doing using this approach for many other thematic areas. Maybe I could talk about it later.
Be really interesting for the audience to really hear more about communities and how central they are in that process. So I want to now turn to Audrey, and Audrey has done an enormous amount of work with ECJUD as well in participatory learning and action approaches, as well as across other fields of interest that are relevant to planetary health, whether that's looking at the concept of care, whether that's environment and health interface, whether that's maternal and child health. So Audrey, turning to you now, what do communities mean to you? I think that's the first part of the question. And the second part of the question is from a planetary health perspective, how can we engage more effectively with communities, in your opinion?
Thanks, Geordan. When I think about communities, I think about the tension between making our notion of community as expansive and as inclusive as it can be, while still enabling action. And so let me try to illustrate this with a couple of examples. So with ECJUD, for instance, we've tried to address some fairly thorny and intractable issues, high rates of maternal and newborn deaths in rural areas. And I think ECJUD realized very early on that although there was a tendency at the time to just put the responsibility on saving newborn lives and saving maternal lives onto women and women's groups, these were problems that could only be tackled through the involvement of other community members, husbands, village leaders, healthcare workers, political decision makers. So the process of PLA, participatory learning and action, is not just about working with that once women's groups, but it's about expanding the community that gets involved to resolve that particular problem. And I think in planetary health, the challenge we face is that this is probably the area of research in which we need the most expansive definition of community. Because if planetary health is premised on the idea that human well-being depends on the well-being of the Earth's living and non-living systems, it means we have to take into account humans, non-humans, and all the systems that underpin their health. And so that's a fairly expansive definition of a community of concern. And I think that the challenge for us is, do we have the disciplinary bandwidth and the academic research and communication mechanisms to allow people from different disciplines that are listening to these diverse communities to come together? But also, do we have the right concepts to even think about the linkages between these different communities of humans and non-humans? And ecology has a long history of thinking about that, obviously. But I think in public health, we're just learning to catch up with some of these questions. I think it can seem a bit daunting, and there might be ways in which we can make this a little bit less daunting. And one of them might be to try and use a translocal lens. And we've done a little bit of work on that, Geordan and Parabita together, recognizing that some locally embedded human institutions, for example, non-governmental organizations, will have access to expertise about how processes that connect living and non-living systems produce or undermine health over time. And that local expertise is incredibly valuable. And if planetary health is going to be a social movement, then there are strong benefits for it to be translocal, not rather than just a sort of a discipline that extracts GIS data and data and compiles it and pushes it out to the Lancet, for instance. There is value in that translocal sharing of expertise to build a new academic community. I think another way maybe in which we can make this expanding the notion of community in planetary health a bit less daunting is to think about some concepts from philosophy and social science. So Bruno Latour, who died very recently, and others have been rethinking the social really as a kind of movement of reassembling associations of things, people, and ideas over time. And I think that's quite useful in a way for both blockchain and planetary health, because there are parallels with them. Of course, there are feminist theorists like Donna Haraway, who famously coined an epoch that in a way goes against the Anthropocene. She calls it the Stulocene, in which humans and non-humans are inextricably linked. And she thinks that we are in this epoch, the Stulocene, where we are required to make each other rather than simply make ourselves, so humans and non-humans together. So just to summarize that, I think we constantly face that tension of this ever-expanding notion of community, and we need new networks and new tools to help us do that. And we already have some in the networks that exist through translocal connections. And we also have concepts from philosophy and the social sciences that can help us make these links.
Into talking about blockchain and DAOs is this notion of needing more tools or better tools to build networks. But one of the things that I think would be quite interesting to ask you about, Audrey, as well, is that a lot of these health initiatives that we've talked about are physical, localized, and I'd be curious to hear from you, firstly, how you think about communities, because blockchain has opened up a whole plethora of ways that we can start to rethink and to build, but these are very, communities built in a very different space to a lot of, localized health initiatives that we've been talking about so far. So I'd be curious from your perspective, what communities really look like on the blockchain, and how does one start to even build based on knowing all of these social challenges and translating them onto the chain? Over to you, Audrey.
Sure. Yeah, I think blockchains are still in a really early stage where it's mostly technologists and financial people engaging with them, and there's not a ton of communities that are being enabled by these tools yet. I think in the last year, we've seen it like exponential growth in new communities coming in because the technology is getting easier to use. But so far, the communities that use blockchain, the communities that have like grown within that blockchain space are like focused on kind of building out the tools and not so much on using them. And so I think we're going into a stage now where, like I said, the tools are getting more usable. And so what I'd like to see is communities that have nothing to do with tech or blockchain, seeing how these tools can help them with problems that they're facing, specifically around coordination. And so I would think of the intersection of communities and blockchain maybe through an analogy to what did the internet mean for communities, let's say in the 90s, early 2000s, right? You had physical communities, and then they started maybe making email chains, email threads with one another. Maybe they had chat groups. Today, maybe they use Slack and Discord. Maybe they have Facebook pages, maybe they have Instagram pages. Maybe they're listed in Google Maps, right? So they use this whole world of like web technologies, mostly, so far for purposes of information, of media, right? So publicizing what they're doing, connecting members with one another. And what blockchain then adds to that is this new layer of the internet that's not just about information, but is about value, is it enables them to act more meaningfully as a community in the virtual world. So coordinating around spending of money, coordinating around making of decisions, things that tools like email or chat or social media don't give you the power to do, because they're still at the end of the day just about media, not about secure information and basically money and permissions and things like that governments or corporations use the law for. But communities are basically excluded in that in large part. If a community wants to be represented outside of the sphere of people like talking with each other and helping each other in person, then they're forced to mold themselves into one of these templates that the modernity has given us, like a nonprofit or a labor union or a corporation or a municipality, right? So there's this very limited number of templates that communities can use to act in the modern world. And largely they're not templates that those communities were part of designing. They're templates that they're taking from some like Euro-American context. And so, yeah, I think with blockchain, what we're starting to see is communities taking these tools, remixing, modifying them, adapting them to their needs. And we could go into examples of that later. I know it's pretty abstract what I'm saying at the moment, but that's how I would think about the intersection.
In a moment, but maybe just we could take a moment to talk through what a decentralized autonomous organization is, just so that we can sort of get a shape of that. So then we can start to talk about practical examples in a moment as well. Just thinking about some of the participants who are joining us from the planetary health world, who probably this is the first time that they've heard of a DAO.
Sure, I can attempt to give like a rough definition. I think there's lots floating around out there you could Google, but roughly speaking, DAO is like an entity that natively is on the internet. So like it's basically using smart contracts, self-executing agreements to embed the rules for a group of people to do something together. And so, examples of this are a group of people who want to spend money together. Maybe they're giving a part of their salary to the pot of money, and they've, instead of having like a written agreement of how they're going to make decisions around spending that, there's code that defines the conditions upon which money can be pulled out and what thresholds are needed amongst the different people. So it's just one example. But yeah, roughly speaking, it's a way to formalize like relations between a group of people through code that doesn't rely on any like intermediary or company or government to run, but code that can like execute its own conditions. And blockchain is the kind of like magic technology that enables this, because you don't need to hope that like some bank or some like big tech company or some government like keeps the rules of your organization enforced. It's like you can enforce it yourself through open source code, basically.
Thank you. Yeah, I mean, something that Audrey said earlier about rethinking the social also rings true here, is that you can start to encode certain systems of values that exist in the real world, yet can be translated online. And maybe we'll return to that in a few examples now. I'm also seeing some great questions coming through, and to let you know, we'll get to them in just a moment, but I think what we'll do first is just turn to some practical examples about how communities can actually be built more effectively, starting in Jharkhand and with Ekjut, and building up to this big tent community that Audrey introduced earlier as well. So Parabita, with your work with Ekjut, I'm just wondering if you could give us a few examples about the tools that you have to be able to really start to strengthen communities, and then what the outcomes have been by effective community mobilization with Ekjut.
Surely. So when we talk about the tools, this participatory learning and action approach, in this approach, we use tools like picture cards and storytelling sessions or games through which we engage communities to deal with various issues. And since these are picture cards, so there are less text, so it doesn't make those who are not able to read to avoid the entire process. They also participate in that particular approach or the monthly meetings that happen. And when there are like games or role plays, also through that also it makes them understanding the issues in a better way, even if they don't, if they're not able to read or write. When we talk about the examples, like how effectively this approach has helped us in dealing with many issues. So we started in 2005, and our first trial is known as Ekjut trial, where using the same approach, we could show the reduction in neonatal mortality rate. It was around 32% reduction in the overall population. And when we say the most marginalized section, the reduction in neonatal mortality rate was much higher. It was 71%. First time it was tried with facilitators from Ekjut. So the sustainability or the upscaling of this entire approach was a question, whether it's possible to do with any other cadre or not. So the next time when we tried this, we tried with the government frontline cadre, who are ASHAs or the community mobilizer, and who is also a woman. Through that, when we did this intervention with them, the reduction in NMR or the neonatal mortality rate was same. It was 31% overall reduction. And absolutely in marginalized section, the reduction was much more. Later, that approach was scaled up in a larger geography, and we tried with around 40,000 ASHAs in the entire state of Jharkhand. And the study spanned from 2017 to 2021. And we could again sustain that reduction. It was 24% reduction in NMR. And again, this approach, as I mentioned, that the toolbox doesn't require much text and much infographic. It's more infographic in manner. So we could actually bridge the language barrier as well. This method, though we started to deal with maternal and child health issues only, but we didn't restrict ourselves to that. We slowly, use the same approach to deal with the data diversity issues, adolescents' health, mental well-being, gender violence cases, and linking nutrition with agriculture and natural resources. Also, in the same intervention, we tried to understand the effectiveness of the approach, the participatory learning and action approach, with some other tools. And we have seen that a PLA approach is turned out to be most effective in dealing with the issues with the community. So in one of the studies we did in 2012 to 16, which was Community Action Research Initiative for Nutrition and Growth, we saw that more caregivers washed their hands before feeding the children. After the intervention, there was a remarkable change. They were washing their hands before feeding the children. More infants survived till 12 months, and there are very few children who were underweight at 18 months. When, as I mentioned, that we try to use the same approach when linking agriculture and nutrition. So we also saw that there was an improvement in dietary diversity in maternal and child nutrition after the intervention. Similarly, in dietary diversity program, we also found that, that there were timely introduction of semi-solid and solid foods, minimum dietary diversity for children of 6 months to 12 to 2 years increased, and minimum meal frequency was also more. Then when we figured out the cases of gender violence was more in the area we are mostly focused on, and it's a tribal dominated area, we did a pilot study, and we find, and after the intervention and after making community empowered with this approach, there was 83% more report of the violence, and they reported is as unacceptable. More women reported violence, and 46% to 60%, they also requested help when they face violence from husbands or families. When we tried this approach with adolescents' health and well-being project, where we focused on mostly adolescents from the whole tribal communities, we found that both the boys and girls, there were more awareness of using a soap, and increased awareness of general well-being. They were mostly taking suggestions or advice from the health facility instead of their local healers. They were more into planting trees. They were more into environment conservation. And in that way, we could see the leadership growing in them. They were more interested in sports, and they were also making, kitchen gardens to deal with the daily nutrition supplements, etc. We have been also able to find out few cases of individuals who are dealing with psychosocial disabilities with this particular adolescence. And at the moment, they are bridging the gap between those individuals and the main community to bring them back to the streamline. So these all are some of the evidences that we have found happening, or intervention is being effective in bringing changes on ground.
Wow, Parabita, that's thank you so much. And I mean, I think that the core of this is that really healthy and truly participatory communities and community building approaches like PLA have the opportunity to really be impactful, and to really enhance agency across a whole array from human to non-human health. Now, thinking along the same lines as you know, as you've pointed out with the types of tools and the impact, I want to turn now to Audrey and see what we can do to translate this to the blockchain and ask about what is it that you've seen that really are effective tools to help build communities on the blockchain, and maybe you have a chance to reflect on some good examples here from your own experience.
Sure. I think that the power to co-manage finances is a big one. Basically, like in a lot of community projects, you'll see, you know, money being raised, and then it's kind of stewarded by one person, let's say. And so from anywhere from like massive scale, right, like with nonprofits and stuff, to like small, you know, raising a couple $100 in like for a neighborhood project. I think there's a disconnection between kind of the control and like the transparency and like the kind of execution of day-to-day kind of like operation spending. So this is just one example, but I think what I've seen is that when that money is all like in a transparent like thing that you can see through a website, and people can see every like request that was made and like make a request and see who inputted yes or no on requests, then it's seen it made like a big difference in people being like, oh, aha, like I'm a part of this, I can influence this. This isn't like something abstract that like I've now given away my agency, and I hope that this steward or this treasurer or something can like handle our concerns and our best interests. And it's not so much about like risk of bad actors, because most of the time people, especially in a community project, are trustworthy, and that's not what, but basically it eliminates the kind of like friction that is typically there, that's largely invisible to us when there's trust involved with especially money. So that's one example. But more tangibly, I guess, yeah, like voting is a big thing that like blockchain communities are really passionate about, right? That decisions kind of get put up, and maybe there's some rules that are predetermined for what's considered a passing vote for different kinds of actions, and people kind of get engaged by it. That also has its downsides, because there's like only so much that people can like pay attention to. It is useful to like delegate to somebody, but yeah, I think just that ability to write your own rules for how like a community coordinates is powerful.
See a lot of similarities coming together. Now, I'm aware of the time, and we've got some amazing questions coming through, so I think I might turn to a few of these questions. And the two, well, there's sort of three areas of questions that I think would be really interesting to tackle together as panelists. And one of the questions that Audrey mentioned before is, how do you really attract users beyond those who are sort of already the technology forward people, but how do you attract users from all over the world and really retain them? And a question that came through is also talking a little bit more specifically about accessibility and inclusion. So one of the questions talks about gender inclusion, and I would say, like, more generally thinking, at the global level, social inclusion on transition to blockchain-based governance, because of the many structural discriminations that women specifically face in access to technology. So I'd like to put that to the panel. Audrey, you may have seen some examples there. Parabita, in your day-to-day life, there's probably some examples on access issues. And Audrey, you may also like to sort of return to reflect on how do you really start to attract users beyond those who are already early adopters.
I can try to get the ball rolling on this. Listening to Parabita and Audrey, I also became conscious of the many similarities that there are between offline group processes like the ones we see in participatory learning in action, and what you described as some of the key things that you might do in blockchain, so shared ledgers and voting. These are things that, of course, participatory interventions do offline as well, albeit on a smaller scale. So how do you minimize the barriers to access? Well, in the offline world, I guess quite often you have brokers between people who might normally be excluded from participating in these processes. So in the case of offline group meetings, they might be a facilitator. In the case of self-help groups, there is a woman who acts as a bit of an accountant and who does the relay between the individual group members and the wider self-help group institutional architecture. So maybe there's a possibility of having brokers who sort of connect potential participants who might otherwise be excluded to a system like blockchain. And of course, if you think about this as part of a phase process, then engaging people from minoritized groups as part of the governance structures of blockchain it would seem like an obvious next step as well. But I'm sure Parabita and Audrey have thoughts on this too.
Yeah, I think that the broker idea is a good one, and you need more like last mile kind of attention to the last mile, like not just making the mechanisms in the virtual space fair and efficient, but thinking about like who it's going to touch and how people are going to like find out about it. And so I think that needs to be proactive, because if you just stay with the defaults, yeah, like any structural inequity in the broader world is just going to then replicate itself there. So unless you like actively like have efforts to counteract it, it's going to start off at least with those same imbalances. My hope is that over time, because like the medium itself is more not hopefully not replicating those inequities, that would smooth out, and that like maybe in the earlier stages, like I've already noticed firsthand just like the number of like women working on building tools for DAOs and then like starting DAOs is super high and has grown immensely, like just in the last like year or two. And there's just like a way more colorful variety of projects that people are applying DAOs to, as compared to 2 years ago when they were maybe almost all focused on like finance. Now you have things focused on regenerative agriculture, science research. Yeah, even like there's a DAO that comes to mind specifically focused on inclusion. And in this case, it's inclusion of the younger generation. So it's called Dream DAO, and it focuses on getting Gen Z to be like leaders in the DAO space. And so they place basically like kids out of high school from around the world into different DAOs to be like helpful to earn tokens, to earn cash equivalent tokens for their labor. And ultimately, I think what DAOs enable is like new ways to coordinate like people doing work together is a big part of it too. And so if you're reliant on more transparent structures for payment, for allocating money, then you won't like keep perpetuating the inequities that maybe have ossified in systems like corporations, where they're not transparent and where there could be massive like imbalance in the hierarchy of control and pay scales and different aspects and leadership, but they're kind of like invisible. And so I think like once you get into blockchain, it's a lot harder to do like things that are messed up. Like if they get called out right away, like you see really like DAO drama is like a big thing, because like people will notice right away if something's happening in an unfair manner, and it gets called out. And that's a cultural thing, but it's also kind of a function of the way the tech works.
It is something that's a real feature here. Parabita, did you have any other reflections, or should we move to the next
Yeah, I just wanted to reflect on that, I have been, as I mentioned, that I have been working on integration of technology and making an app for reporting for the frontline workers. So the issue I've been facing over there, like, the network connectivity, access of the devices, and then the language. Every time it's not possible for them to access that particular app or any features which are useful or available in English. And this population is a huge, and like we had to make our app available both online and offline, available in both the languages, make it more simpler. So definitely I look forward to the blockchain technology and more information coming about it in a more simpler way, so that it's accessible to most, and the participation is more from the women and youth, obviously. Yeah.
Not that I'm super familiar with it, but there seems to be a movement towards sort of mobile first, or at least mobile accessible blockchain tech. And as Ari mentioned, that there has been such a wave of change over the last few years in this space. I mean, really, it's fast. But I want to move now to another question, which is about once we've built the community, how do we sort of keep people there? And a question that's come in from Grace is about how communities deal with attrition or people who want to leave. Are there ways to see signs where people are going, before they are going to leave and then remediate? Are there ways for people to exit? Is there a procedure for having people return if they leave communities? I think that's a really interesting one, and I think that's once again applicable to both communities of practice in planetary health and communities of practice on the blockchain. So Parabita, from your PLA work, how do you deal with that? Or do you have any sort of ways that you can sort of notice low participation or people wanting to leave and encourage them not to, or at least remediate?
We have a dashboard, and through which we always capture the average participation in all these PLA monthly meetings. And we haven't seen that this average participation going low. But definitely there are cases of migration in the community. So the individual goes from one village to another village. And when they go to another village, since we have been implementing this program with the frontline worker, ASHA, who are available in each and every village, so they can go and participate in the meeting in the other village also. This is the entire intervention is delivered or implemented in an open cohort manner. So there is no such like closed cohort. And whenever they're participating in one monthly meeting, there is always a recap of the previous one. And they also get to learn for the peer learning process is also there. So in that way, we don't see a much migration or much lower number of participation in the community meetings or the PLA meetings. But definitely during COVID, we had to had some restrictions in participation, and we had to keep it low. But overall, we have seen more than 25-30%. Like the picture you're seeing in my background is also a picture of a PLA meetings happening on ground. So this many people you will find there. And we have kept it as an open platform. So women are mostly focused for these interactions or for the meetings, but male adolescents all are very much welcome. So it's the average participation is more or less similar. You're on mute, Dr. Shannon.
Thank you, Parabita. Sorry. I was wondering now about translating that to the blockchain with Audrey. One of the things that seems to be the case is that participation, it can be a challenge, and an effective, meaningful participation rather than just a core, body of participants in the DAO. So I'm wondering how you really can help to build and maintain communities and encourage or remediate those who aren't participating and or those who want to leave the community.
Yeah, in the case where the community is purely virtual, let's say, exit is fairly easy. But I think kind of part of the question is also, so how do you get people to want to stay? And then what's the process like when they leave, right? So I think in the case of Deorg, for example, like the blockchain developer collective I'm a part of, we have like an escalation process for if somebody thinks that someone else should leave, for like violating our community standards. And so that's all a process that kind of happens like it would in lots of other community organizations. And then it goes to like an on-chain vote if like the action like deserves to be kind of punished with excommunicating the member. And then also members can choose to leave, voluntarily if they want, and then automatically kind of be removed. And I guess the important part with like beyond the technicalities is people having something that they get out of being in the community, and that being the main determinant if they stay. And also if there's like a fair process for working through differences and reaching consensus. Because I think what we see is that people tend to want to leave communities if either they're not getting value out of it, there's like nothing going on there that's helping them, that they feel like is a part of a bigger cause, let's say. But also if I lost my train of thought. Yeah, anyways, so people leaving can also be a function of, I'll pass it off. That's all I got.
Audrey, maybe over to you. If you see anything that you'd like to pull out from what Audrey or Parabita have just said around that sort of strength of community.
Yeah, absolutely. While Ori was talking, I was reflecting on the fact that communities evolve and some of them go extinct, and sometimes that's a symptom of issues that need reflecting upon. And if we think about public health, a lot of the issues that we face are because of, in a way, institutional inertia within public and global health institutions, and that can perhaps benefit from a shakeup through more nimble organizational structures like the ones provided by platforms like the blockchain. And maybe it's okay for communities to emerge and dismantle around problems that they identify and then solve, and then sort of move on to other things. Maybe we don't need to be creating permanent communities, but communities that come together for a purpose and execute things in a way that's transparent. And then sort of move on their separate ways. And maybe one of the assets of blockchain for Planetary Health is that it might provide some of that more nimble sort of mechanism.
Yeah, and that made me remember the second part, which is that people might want to leave because they disagree with the way decisions are made, or that they disagree with the decision that was made. They think it's not fair. And we have this concept in blockchain of forking. And so if something's going in a direction that a subgroup doesn't like, maybe a minority group within the group, they can rip out their participation and start an alternative that has just the same kind of rules as the other one, with like one thing changed or one decision kind of replayed or rewinded. So that's kind of like a first principles thing in blockchain, is like exit is a part of participation. So you can make your voice heard. You can, disagree with the decision that was made and be like, okay, fine, I'm going to stay anyways. But if it like really goes way beyond what you believe in, leaving is, yeah, like Audrey said, like an important part too.
Yeah, thank you, Ori, and thank you, Audrey. I mean, I think this idea of nimble and flexible and essentially open structures that allow people to leave and to be able to sort of evolve and adapt, I think is a really key, and something that probably we don't do very well in Planetary Health, and need to be able to learn from the blockchain world more generally. This brings us to the top of our hour. There's a number of questions that have remained unanswered, and I think what I'd like to do is suggest that we have a stab at these maybe offline over the next few weeks. Some of the questions are around examples of blockchain-based governance to help address health issues. the other group of questions sort of look at what are the institutional and or community issues, for example, through ECJUT, that blockchain can better can be used to improve. So I think those types of questions could be really interesting to reflect on after this sort of bridge building conversation, and to focus on a question as well from the panel, which is really about what is our actual approach to community building at the broadest level. It's more than just technologies. It's more than just one specific approach. What is our collective approach to making common values really salient to all actors? And so I'll leave these questions there as things that we might return to answer. Not on the webinar, but just to say thank you to all of our panelists. I think some of the key things that have been apparent as we've been speaking are the need to really create this sort of nimble but radically transparent platforms for action that, pardon me, that really enable us to align our values and to act and to opt in and to opt out. I also really thought that the discussion on applications and the way that potentially this PLA model that really unlocks community led action is so synonymous with a lot of the blockchain based initiatives that we're seeing emerge. And as Audrey said, this is such a fast moving space, and it's really moving towards application of blockchain for social good. So I believe that we will be seeing like a ton more exciting stuff over the next short while. So just to say thank you profoundly to all of our panelists, also to our participants. It's been an absolute joy to moderate. Sorry, I've got I've got a bit of a cold at the moment, but I'm really looking forward to reflecting more. This webinar will be put online on the Planet Health website. And just to say that if you're interested in this and you like what we're doing, we're having another conversation this time next Wednesday with Jeremy Lauer and Primavera de Filippi talking about governance and financing for Planetary Health, both on and off chain. We also have, we also have our in-person event in France happening on the 21st to the 23rd of October. And we have a few remaining tickets left in a beautiful chateau where we'll be holding an unconference to talk more and to get more deep into these themes, plus also to start to build a platform for ongoing actions. So thank you, everyone. Such a pleasure. And I'll say good night, good day, wherever you are. Appreciate all of your time. Thank you.
Thank you.